Hi, I'm Ella. Thank you for coming to the career fair. I'm going to be discussing cognitive psychology and neuroscience. Success in a career involving cognitive psychology and neuroscience requires specialized knowledge and methodical skill. Professionals must understand how cognitive processes such as memory, attention, and language are supported by neural systems, allowing behavior to be explained at both psychological and biological levels. Understanding ethics is key to protecting both participants of studies and to ensure researchers are conducting research responsibly. Proficiency in data analysis and statistics is also essential, as cognitive neuroscience relies on quantitative methods to interpret behavioral data, neural activity, and experimental outcomes. Successful professionals must understand neuroscientific methods such as neuroimaging and electrophysiological techniques in order to interpret how neural activity supports cognition. Together, these skills enable accurate explanation, prediction, and application of findings within cognitive neuroscience. While cognitive psychology and neuroscience might sound very similar, there are some distinct differences. Cognitive psychology centers on mental processes like perception, memory, attention, and problem solving, which are often studied through behavioral experiments and cognitive modeling. In contrast, neuroscience focuses on the biological mechanisms of the nervous system, including neural circuits, cellular processes, and brain structure, using techniques such as neuroimaging and electrophysiology. This distinction is useful because it highlights how the field approaches the same topic from different angles. Cognitive psychology studies functions of the mind, while neuroscience studies the biological hardware that enables these functions. So, cognitive psychology acts as a kind of bridge between psychology and neuroscience, integrating behavioral theory with neural mechanisms to create a more complete science of the mind. Some exciting careers in this field include speech-language pathologists, commonly referred to as SLPs. They diagnose and treat communication disorders caused by brain injuries, strokes, or developmental conditions, such as issues with swallowing or receptive speech. Incorporating technology has helped this practice evolve over time. Advanced imaging like MRIs help us understand what is happening in the brain during speech, while assistive devices like hearing aids and communication apps can help boost independence. Internet tools like telehealth allow therapists to reach clients remotely, which is a game changer for those who have mobility issues. Neurologists are medical doctors who specialize in diagnosing and treating disorders of the nervous system, including conditions such as epilepsy, stroke, multiple sclerosis, and Parkinson's disease. Historically, neurology relied heavily on clinical observation, patient history, and basic neurological exams to identify dysfunction. Over time, this career has evolved significantly with advances in neuroscience and medical technology. Modern neurologists now use more sophisticated tools such as MRI, CT scans, EEG, and genetic testing to more accurately diagnose neurological disorders and understand their underlying neural mechanisms. Finally, clinical neuropsychologists assess and treat individuals with cognitive impairments because of brain injuries, neurological disease, or developmental disorders. In the past, assessments relied mainly on behavioral tests and patient observation. Over time, this career has evolved to incorporate findings from neuroscience, brain imaging, and cognitive theory. Finally, research in cognitive psychology and neuroscience is very important because it helps us understand how our mind works and how our brain enables us to think, remember, learn, and solve problems. This knowledge is valuable for improving education, treating cognitive disorders, and even designing better technology. It allows scientists to move beyond simply observing behavior to understanding the underlying cognitive and neural mechanisms that shape how people think, feel, and act. Common research methods in the field include behavioral experiments, neuroimaging, and electrophysiological methods. Behavioral methods are used to measure cognitive processes indirectly through indicators like reaction time, accuracy, or error patterns. Neuroimaging methods like fMRI allow researchers to identify which brain regions are active during specific cognitive tasks by measuring changes in blood flow. EEG records the brain's electrical activity, providing precise information about the timing of neural processes. Together, these methods complement one another by linking observable behavior with neural activity. By integrating multiple approaches, researchers can better explain how the brain supports mental functions and apply this knowledge to clinical education and technological settings. Thank you so much for your time today. I hope this has been educational and leads you to pursue a career in a related field. Bye!